Hello, in this video, I will talk about the human eye, an essential organ of the visual system. The eye allows us to capture light from the environment and transfer this information into nervous signal to reach the brain, allowing us to see shades, color, and movements. First, I will explain the anatomy of the eye, including its main structure, its muscle, and the fundus of the eye. Then, I will explain how it's work, and finally, I will talk about a design related to the organ, specify glaucoma. First, I will talk about the anatomy of the eye. In this image, we can observe the eyeball and its main structure. The eye is localized inside the orbit, which is a cavity formed by the bones of the skull that protects the eye from injuries. For example, frontal bone, sphenoid bone, zygomatic bone, palatine bone, and other bones of the face. In the external part, we can find the sclera. The sclera is the white and resistant layer of the eye. Its function is to protect the internal structure and maintain the shape of the eyeball. In the anterior part, we can observe the cornea. This is cornea, and here. The cornea is a transparent structure that allows light to enter the eye and helps focus images because of its ability to refract light. Behind the cornea, we can find the iris. The iris is the color part of the eye. In the center of the iris, we can observe the pupil. The pupil is an opening that regulates the amount of light entering the eye. When there is a lot of light, the pupil becomes smaller. When there is a less light, the pupil becomes large. In the imaging, we can also identify the lens. The lens is a transparent structure that works as a natural lens. Its function is to focus near or distant object by changing its shape. This process is called accommodation. We can also observe the ciliary body. It contains muscle that allow the lens to change its shape. Inside the eye, we can find the vitreous humor. This is all is vitreous humor. It's a gel-like substance that maintains the shape of the eyeballs and supports the retina. In this imaging, we can observe the extraocular muscle. This muscle allows the movement of the eye and help direction or gaze in different directions. The eye has six main muscles. The superior retinal muscle, which moves the eye outward, the inferior retinal muscle, which moves the eye downward, the medial retinal muscle, which moves the eye inward, the lateral retinal muscle, which moves the eye outward, and the superior and inferior oblique muscles, which allow rotational movements and help control the position of the eye. This muscle works together so both eye move at the same time, allow binocular vision. For example, I want to see the right, I want to see the left, I want to see up, I want to see down. And now, fundus of the eye. We can observe the fundus of the eye. The is the internal posterior part of the eye that can be seen during an ophthalmologic examination. Is the image we can identify the retina. The retina is a layer made of specialized nerve called photoreceptors, rods, which allow vision in low light conditions and help detect movement, and cones, which allow us to see colors and find details. We can also observe the macula. The macula is the area of the retina responsible for central vision and high visual acuity. Inside the macula, we find the fovea, which has the highest concentration of cones and provides the sharpest vision. In the fundus, we can also identify the optic disc. This is the place where the optic nerve left the eye, and it does not contain photoreceptor, so it creates the blind spot. We can also observe the retinal blood vessels which provide oxygen and nutrients needed for the retina. For example, inferior nasal retinal arteriole, inferior temporal retinal vein, and the other vessels. And now I will explain how the eye works. In this image, we can observe the path the light follows inside the eye. Light enters first to the cornea, passes to the pupil, and reaches the lens. The cornea and the lens work together to focus light onto the retina. When light reaches the retina, photoreceptor transforms light energy into electrical signals. The process is called visual transduction. After that, the information travels through the optic nerve to the brain. The signal reaches the visual cortex located in the occipital lobe the brain interprets the image. Thanks to the eye muscle, we can move our eyes and direct our vision toward different objects. Also, the use of both eyes allows us to perceive depth and distance. And this is visual pathway. Now, I will talk about what this eye relates to the eye, glaucoma. In this image, we can observe an eye affected by glaucoma. Glaucoma is a disease where there is progress damage to the optic nerve. A common cause is increased intraocular pressure. The eye produces a fluid called aqueous humor. When this fluid cannot leave the eye correctly, pressure inside the eye increases. This pressure can damage the optic nerve fibers. Symptoms may include loss of peripheral vision, blurred vision, difficulty seeing in dark environments. If not treated, it can cause permanent vision loss. Treatment may include eye drops to raise pressure, medication, laser procedures, and surgery. In conclusion, the human eye is a complex organ where many structures work together. The cornea, lens, retina, eye muscle, and optic nerve allow us to see and move our eyes correctly. Understanding its anatomy and functions also helps us recognize diseases such as glaucoma and the importance of taking care of our visual health. And thank you. This is all.